Hello everyone, welcome back to my YouTube channel, The Disease Decoder. Today our topic of discussion is very famous disease, typhoid fever. Actually, it's a fever. Let's start. What is typhoid fever? Typhoid fever is a systemic infection caused by the bacterium Salmonella enterica serotype typhi. It is primarily transmitted through contaminated food and water. The disease is characterized by fever, fatigue, abdominal pain, and other systemic symptoms and can be life threatening if not treated properly. Okay, this is typhoid fever. Uh, it's a systemic infection caused by the bacteria Salmonella enterica serotype typhi, and it is transmitted through contaminated food and water and characterized by prolonged fever, fatigue, and abdominal pain. There are two types of typhoid, typhoid fever and paratyphoid fever. Typhoid fever is caused by Salmonella typhi. The classic form of the disease, classical form of the disease. Second is paratyphoid fever, a similar but usually milder disease caused by Salmonella enterica serotype paratyphi A, B, or C. Our next section is about the risk factors. First risk factor of typhoid fever is poor sanitation. Living or traveling to areas with inadequate sanitation facilities increases the risk of exposure to contaminated food and water. Our next risk factor is contaminated food and water. Consuming food or drinks prepared by someone who is infected or a carrier of the bacteria. Our third risk factor is close contact. Maybe you are living in close quarters with someone infected or carrying Salmonella typhi. Our fourth risk factor is lack of vaccination. People who have not been vaccinated against typhoid fever, particularly those traveling to endemic areas, are at the higher risk. Our last risk factor is weakened immune system. Individuals with weakened immune systems are more susceptible to infection. These are the common risk factors of typhoid fever. Pathophysiology of typhoid fever is very important. Uh, let's consider my drawing. This is the our stomach, this is small intestine, and this is the large intestine. This is a rough drawing. After ingestion of contaminated food and water, Salmonella typhi bacteria passes through the stomach. As we enter contaminated food and water, it passes through the stomach and enters to our small intestine. The bacteria is acid resistant, so it cannot be destroyed by the acidic environment of our stomach. The bacteria then penetrate the intestinal wall and enter the bloodstream. It perforates, penetrates the intestinal wall and enter our bloodstream. Here are the blood vessels, and after entering the blood, it is phagocytosed by macrophages. Macrophages are the cells that are present in our blood. Instead of being destroyed, the bacteria multiply within the macrophage and are transported to various organs, including the liver, spleen, bone marrow, and our gallbladder. Okay. This systemic suppress leads to the characteristic symptoms of the typhoid fever. The bacteria are eventually released from the macrophages. As I mentioned earlier, it is not destroyed in the macrophages. Uh, It multiplies in the macrophages. After multiplication, it is released from the macrophages and re-enter the bloodstream, causing a second wave of bacteremia, which correlates with the onset of clinical symptoms. The bacteria can also be excreted in the stool and urine, contributing to the spread of infection. Uh, Here, I want to talk about the gallbladder. Gallbladder is the reservoir of the bacteria. The bacteria stays in the gallbladder, and when we eat further food after being infected by Salmonella typhi, the bile secreted from the gallbladder causes the entry of the bacteria again into our intestines that causes further spread of the infection. This is the pathophysiology of typhoid fever. I hope you understood what I am saying. As we eat contaminated food and water, the bacteria passes through our stomach and enters our intestine. It is not killed by the acidity of the stomach. From intestine, it perforate or penetrate the intestine and enters our bloodstream, where it is phagocytosed by macrophages. In being killed by the macrophages, it is not killed by the macrophages. It multiplies in the macrophages and again enters into the bloodstream that cause further severity of the symptoms. And gallbladder is the reservoir, as I mentioned the role of gallbladder too. Next section is about the signs and symptoms of typhoid fever. Prolonged fever is the first sign and symptom, generally rising temperature that can reach as high as 104 degree Fahrenheit or 40 degrees centigrade. Second sign and symptom is weakness and fatigue. Third sign and symptom is headache. Fourth is abdominal pain. Abdominal pain particularly in right lower quadrant. Right lower quadrant. Diarrhea or constipation. Children are more likely to experience diarrhea. Children, while adults usually develop constipation. Rose spots is the most common sign and symptom in typhoid fevers. Small rose-colored spots on the abdomen and chest that appear in some individuals, not in all individuals. Okay, rose spots on abdomen or chest. Enlarged spleen and liver, loss of appetite. Patient with typhoid fever don't want to eat anything. Dry cough and delirium. Delirium is a serious mental disturbance that causes confused thinking in the patients of typhoid fever and reduced awareness from the environment. Next section is about the major complication of typhoid fever. The major complication of typhoid fever is intestinal perforation. Intestinal perforation. Intestinal perforation occurs due to prolonged inflammation that results in the ulceration of the intestinal wall, and it is treated with proper antibiotics or with surgery. Okay, this is the most severe complication of typhoid fever, intestinal perforation. Our next section is about the ways of diagnosis. These are the common ways for diagnosis of typhoid fever. First way is blood culture, the most effective test, especially during the first week of illness, as it can isolate Salmonella typhi from the blood. Okay, this is the most definite, most common use. Our next is stool urine culture. Uh, can be used to treat the bacteria, especially in late in the course of the disease. Our third way diagnosis of typhoid fever is vital test. Vital test is a serological test that detects antibodies against Salmonella typhi. However, it is less specific because it can give false results. Less specific. Our fourth way of diagnosis is bone marrow culture, considered the most sensitive test, especially in cases where antibiotic treatment has already begun. Our last way of diagnosis is complete blood count. CBC may show anemia, leukopenia, or leukocytosis. Leukopenia means low white blood cell count, and leukocytosis means high white blood cell count. Okay, these are the five ways for diagnosis of typhoid fever. Our next section is about the treatment. We treat typhoid fever by three types of antibiotics: first line, second line, and third line. In first line, we use ciprofloxacin, and this is the antibiotic. Second line antibiotics is ceftriaxone. We use second line antibiotics when first line antibiotics don't show proper results. Our third line of antibiotics, we treat by meropenem. Meropenem is the third line antibiotic, and it is used when both these drugs are not showing any kind of results. Okay, these are the treatment options for typhoid fever. Our next section is about the sportive care. Sportive cares include hydration, oral and intravenous fluids to prevent dehydration. Antipyretics are used to manage fever, and surgery, as I mentioned earlier, in cases of intestinal perforation, which is a complication of typhoid fever, surgical intervention may be necessary. Intestinal perforation. Surgery is necessary in intestinal perforation. Vaccination is most important for prevention of typhoid fever. We use three types: typhoid vaccine, oral live attenuated vaccine, and injectable polysaccharide vaccine. Typhoid vaccine is recommended for travelers to endemic areas and people living in regions with poor sanitation. Oral live attenuated vaccine is taken in capsule forms, and injectable polysaccharide vaccine is given as intramuscular injection. How we prevent from typhoid fever? Preventive measures, so that we prevent typhoid fever is by drinking safe water. Avoiding drinking untreated water, especially in areas where typhoid is common, is necessary. Food safety: avoiding raw foods, unpeeled fruits and vegetables. Only eat food that is cooked properly and still hot for the prevention of typhoid fever. Hand hygiene is the next step. Regular hand washing with soap, especially after using the toilet and before eating, is most important for prevention from typhoid fever. And last is vaccination. I talked here as well about vaccination, recommended for travelers and individuals in high risk areas. This is all about the typhoid fever. Let's summarize. Typhoid fever is a systemic infection caused by the Salmonella enterica serotype typhi and spread through the contaminated food and water, and caused by and characterized by prolonged fever, fatigue, and abdominal pain. It is divided into two types: typhoid fever and paratyphoid fever. Both are caused by different types of bacteria. Then I talked about the risk factors: poor sanitation, contaminated food and water, close contact, lack of vaccination, and weakened immune system are the major risk factors for typhoid to occur. Then I talked about the pathophysiology in detail. Sign and symptoms include prolonged fever, nearly 104 degree Fahrenheit or 40 degrees Celsius, weakness and fatigue, headache, abdominal pain, diarrhea in children, and constipation in adults, rose spots on abdomen and chest, not in all patients, enlarged spleen and liver, loss of appetite, dry cough, and delirium. Major complication of typhoid fever is intestinal perforation. There are five ways of diagnosis: blood culture, most commonly used, stool and urine cultures, Widal test, bone marrow cultures, and CBC. Treatment options include first line antibiotics, second line antibiotics, and third line antibiotics. Supportive cares include hydration, antipyretics, and surgery For intestinal perforation, vaccination is very necessary for the prevention of typhoid fever. Here are the preventive measures for the prevention from typhoid fever: safe drinking water, food safety, hand hygiene, and vaccination. This is all about the typhoid fever. If you like the video, don't forget to subscribe the channel and share with your friends for the enhancement of their clinical skills too. Thank you.